According to the most recent numbers, more than 1,000 people in San Diego County are still testing positive for COVID every day. With that comes an isolation period that can last between 5 and 10 days. That's according to the State Department of Public Health. But what should you do if you're testing positive beyond that time frame? CBS 8's Shannon Handy has more on her own experience and advice from a local doctor.
Recently, I tested positive for COVID-19 thinking I'd be negative within that 10-day window. Well, I wasn't, and I've since learned a lot of people have been in that position. So I turned to an expert here at UCSD to find out what to do.
I cannot get out of bed.
That was me a couple weeks ago, right after I tested positive for COVID-19.
I hope none of you get COVID.
My symptoms only lasted a few days, but after completing a 5-day isolation period, I was still testing positive. By day 10, I was still positive. Finally, on day 11, I tested negative. That's when I returned to work. But it left me thinking, what should someone do if they continue to test positive for weeks or even months? When is it safe to go back to your normal life?
It's never black and white.
Dr. Francesca Toriani is the Program Director of Infection Prevention and Clinical Epidemiology at UC San Diego Health. She's also a professor of medicine and member of UCSD's ID and Global Health Division. She says when it comes to this latest strain, BA.5, people are testing positive for longer periods of time.
In the immunocompromised population that we serve in the hospital, we see this shedding going on quite, weeks.
Shedding means the virus is still in one system, but the State Department of Public Health only offers guidance through day 10. I asked Dr. Toriani why that is.
It's part of that bell curve, and if we were monitoring for every single person who got infected, we would be keeping many, many more people out of action, out of work.
Dr. Toriani says while there is no hard rule on the matter, it really comes down to symptoms. If you still have any beyond day 10, continue to isolate. If you're asymptomatic but still testing positive, it's likely okay to end isolation as long as you're taking extra precautions, especially around those who are immunocompromised.
If you feel good enough to go back to work, then go back to work, but wear a mask. At a certain point, we have to integrate it and normalize it. It doesn't mean that the pandemic is gone. We just have to modify our lives so that we keep other people safe.
Shannon Handy, CBS 8.